Hi, my name is Alina and I'm 14 years old.
Hi, my name is Dan and I'm 11 years old.
We are going to be interviewing our dad today about his research.
Hi, I'm Dr. Kaashif Ahmad. I'm a clinical researcher and a neonatologist at the Children's Hospital of San Antonio Newborn Intensive Care Unit. A neonatologist is a doctor who takes care of sick babies or babies that are born preterm, which means that they were born weeks or months before mom's due date.
What kind of research do you do?
We do all kinds of research at the Children's Hospital of San Antonio, but there's two broad kind of categories of research that we do. The first kind of research is what is called database research. And what a database is a large collection of information from a large group of babies. And so we have information that we've collected from thousands of babies across the country. We bring it all into one place, and we can ask questions that are interesting to us from that data set. And so that's part of what we do. The other part of what we do are what are called clinical trials, where we test new medications or new devices to see if we can help make sick babies better faster.
What have you studied in the databases?
So, there's all sorts of things that you can study in databases. The only limitation is what questions you can think of. The first question that I ever asked of the database really was a study that I did with your mom, who's a pediatric neurologist or a pediatric brain doctor. And what I was interested in finding out was what medications are we using these days to treat sick babies that have seizures in the intensive care unit. And so what we found out when we did this study was that over the last 10 years, more and more, there had been a medication called Keppra that was being used in the newborn ICU. And Keppra is a newer medication that we found kind of concerning because there's actually very little evidence that the medicine works in babies. And now, 3 or 4 years after we did that research, new information has come out that has actually proven that medicine is not effective in helping babies with seizures. And so we kind of caught that trend early, and later evidence has proven that maybe we shouldn't be using that medicine in babies as often as we were.
You said that you trial new medicines and devices to see if they help babies get better. What do you mean by that?
Yeah, so that's a great question. And so, whenever any of us get sick or when we go to the pharmacy and we take a medicine from the pharmacist, that medicine has been tested in some way to prove that it's helpful if someone is sick. That's always done by a clinical trial. And so the way the clinical trial works is you take a group of, in my case, babies who are sick that have kind of the same illness. And if you have a new medicine that you want to test, half of the babies will get the medicine and half of the babies will get the usual care, the best care that you can provide. And you follow them over time, and if the babies who got the new medicine or the new device end up doing much better, if they get better faster or if they have a better outcome, then that's proof that the medicine is effective, and then we can start to use that in all babies. One of the groups of babies that we really worry about the most are babies that have a problem during the birthing process, where something has happened and their oxygen supply has been decreased or even cut off during the delivery. And what can happen then is that after they're born, they're just really sick. And because they had their oxygen supply decreased, they can have a lot of brain injury or brain damage. And that can be really scary for the parents and also cause a lot of harm for the babies. And so for a long time, we had no treatments that were really helpful for them. Their outcomes were not good. And then many years ago, in fact, when I was in training, there were a big clinical trial that was done across the country. And what they did was they took babies that had this illness and they tested this device called a cooling device. And this is the cooling blanket that we use here at the Children's Hospital of San Antonio. The way that this works is that this device goes under the baby, it's filled with water, it connects to this machine, it makes a cold blanket for them to lay down on, and it lowers their body temperature by several degrees. So in the clinical trial many years ago, what they did was that half the babies were put on this blanket for 3 days, and half the babies were not. They were given usual care. We followed those babies over time, where people like me did, and they followed them out until they were 2 years old. And what they found was that babies that were cooled had a significantly better survival, meaning more of them lived to go home with their parents, and those who survived to go home had much better outcomes. Their IQ testing was better, they did better in school, and so this is standard of care now for all babies that have this problem.
What kinds of medicines are you studying?
That's a really good question. So even though we have this cooling blanket, this is still probably one of the groups of babies that we worry about, I think, the most, because the outcomes are still not perfect. We're still looking for ways to get them better. And so we're now testing medications to see if we can improve their outcomes even more. One of the medications that we're testing is a medicine called erythropoietin, or EPO. And what we're doing now is that when we have babies that have this oxygen problem, they will all come into our NICU. They're all put onto this cooling blanket, but now half of them are going to get the medication, the EPO, and half of them get the usual care, which includes the blankets. So we enrolled a large number of babies here at Children's Hospital in that clinical study, and in fact, it was done across the country. Over 500 babies were enrolled nationwide. We've finished enrollment. We're actually calling these parents every 3 to 6 months at home to check on how their babies are doing. And all of them will come back into our clinic when they're 2 years of age. And we're going to do detailed developmental testing, almost like an IQ test on a 2-year-old, to see how they're doing. And we'll compare the scores for the babies who were getting the medicine versus those that were not. And if the babies who got the medicine score were much higher than those that didn't, that would be proof that the medicine works. And then what would happen is that then this medicine would be the standard medicine we give to all babies when they come in being sick like this.
How does cooling down a baby actually help them?
So the injury that the baby had when the oxygen supply was cut off, that's kind of already happened. We can't necessarily reverse totally that injury, but the problem is that when that injury does happen, that's not the only problem. That first injury leads to a cascade effect. The first injury leads to secondary problems and then third order problems, and that's what we want to minimize. So when we cool a baby down and we slow down their body temperature, slow down their body chemistry, and really slow down everything, it actually also slows down this cascade effect. And our goal is really to limit the injury to what happened in the very beginning and not allow other things to happen later on. And we actually know now from a lot of research that much of the problems we see in these babies long term is what happened after the first injury. And so we want to try to limit that as much as we can. And the cooling blanket is really effective for that. But as we mentioned, the cooling blanket doesn't fix all of the problems because it doesn't really fix the first injury that happened. And so that's why we're still testing new medications to see if we can improve their outcomes.
Well, that's really great work that you're doing, and it's really making a great impact on all the babies.
Thanks for answering all of our questions. It helps us understand your work a lot more.
Thank you both for asking such great questions, and I really appreciate you being so thoughtful and asking me about what we do here at Children's Hospital.
Thanks for watching.